With all the ambitious projects unleashed or indeed thwarted today, the question of funding looms large. From new hospitals to transport infrastructure, new projects can capture the public imagination. But when it comes to paying for them, that's a trickier question. So much so that governments had in the past resorted to PFIs or private finance initiatives to raise the money. It's a way of borrowing the capital and then repaying over the long term, a system used widely during the years of the last Labour government. However, a Newsnight investigation has revealed the extent to which rising inflation has hit public institutions with extra costs. We'll ask in a moment whether PFI should be part of future spending plans, and if not, where else the government might find cash for capital spending. First, here's Ben.
The Private Finance Initiative, or PFI, initiated by John Major's Conservatives, rolled out massively by New Labour.
On time and on cost, on time and on cost.
The PFI theory let the private sector build and operate swish new public buildings, including hospitals, and then let the public sector pay off the debt over many decades. It was supposed to keep down the national debt and save public money. But PFI is adding tens of millions of pounds every year to the running costs of institutions like hospitals, relative to if the government had simply borrowed the money to fund the construction itself.
There's another sting in the PFI tail. The repayments of institutions like this London NHS Hospital Trust are linked to inflation. All the risk of higher prices is borne by the borrower, not by the lender. And given the high inflation we've had recently, you can imagine how much extra financial pressure this is imposing. This NHS Trust warned in its most recent financial report that its PFI costs, partly thanks to inflation, had jumped to £40 million a year and pose a significant financial risk.
Indeed, Newsnight, working with the Independent Centre for Health and the Public Interest think tank, has been able to determine that inflation has added costs of almost £500 million to English hospital trusts over the past 2 years. That's equivalent to the salaries of some 7,500 newly qualified nurses. This is on top of the £2 billion they are repaying in ordinary PFI charges every year.
In some instances, the payments to PFI companies for some NHS trusts exceed the amount that they spend on drugs. And that was before these very large increases in inflation, which means that the high charges that are being levied on these trusts in order to pay for PFI are inevitably going to have an impact on other available resource for patient care, for paying for staff, for other things that they might want to do.
UK hospitals still have at least £54 billion to repay in PFI charges over the coming decades. But schools built with PFI also owe around £17 billion, and the negative impact of inflation on their annual payment has been similar to that of hospitals. Imran Iqbal, the head of PFI-built Holly Lodge High School in Smethwick, has seen his school's repayments jump to £1.5 million a year because of inflation, 13% of his entire budget. And it's become a serious constraint on what he can spend.
We've got 6, 7 IT rooms, and all of the equipment in those rooms needs replacing. It's nearly a decade old. We've got updates coming through Windows, and we're talking about actually our hardware won't be compatible soon. What we do in school isn't as good because of the financial constraints that we're under than what we would have done if we didn't have that contract. If it wasn't for the contract, we would have more teachers in our schools, we'd have more support staff in our schools, we would have more SEN support for our most vulnerable.
The Department for Education said the department supports schools that have unavoidable extra premises costs related to their PFI contracts through the PFI factor in the school's national funding formula. The Department of Health said we are supporting NHS trusts to ensure they're implementing high-quality contract management to achieve better value for money.
The government stopped using PFI in 2018 and inflation is coming down, so you might be wondering why all this matters. Well, it matters because the financial legacy of PFI will be on the shoulders of many schools and hospitals for a long time to come, decades in some cases. This school has another 10 years on its PFI contract. So if inflation comes back Over that period, all these financial pressures will also come back.
I want a solution that means that and the impact that it's having on young people is addressed directly. So whether that means renegotiating the contracts, whether that means finding an exit clause for the contracts, I want to stop paying 1.5 million of the school's budget on a contract, and I want to be rerouting at least half of that, which is what we should be doing, back to our young people and the education they receive on a day-to-day basis.
There's another awkward question. With the public finances tight, how is this government or the next one going to finance the construction of more schools and hospitals without PFI? Remember Labour's Building Schools for the Future programme, which the coalition controversially cut in 2010? That was largely PFI.
PFI, unfinished business for the public sector. A problem not consigned to the past, but one that very much still encloses this generation.
Ben Chew with that report. Well, to discuss PFIs for and against, we're joined by Stella Creasy, Labour MP for Walthamstow, and John McTiernan, who's here in the studio, who was a senior Downing Street official under Tony Blair. Welcome to you both. Stella Creasy, PFIs allowed the new Labour government to do amazing things, didn't they, in terms of school or hospital building?
Look, governments of all colours have used PFI from 1992 up to 2018. The 700 projects span the decades, but frankly, they are the legal loan sharks of the public sector, because the way in which these contracts are written and the commitments that they make have allowed these companies to not just hike up their fees, but to repeatedly benefit from the fact that we don't let schools and hospitals go bust. So whether it's the dividends that they're paying to the directors or the fact that we have paid for the inflation increases for these, and you heard from that school, I've got schools in my constituency affected by it.
Well, tell us about that. Tell us about the effects in your constituency.
They're wide-ranging. Look, I represent a constituency that has one of these mythical 40 hospitals that the government is supposed to be able to build, called Whipps Cross. We've been trying to rebuild Whipps Cross for decades now. And if I think about Barts, which owns Whipps Cross as part of its trust and has the largest PFI in the country, well, they were paying £120 million in their PFI payments just a few years ago. It's now 150 million. The rebuild for my hospital would be 900 million. So actually, we could have covered the cost of building the new hospital that my community so desperately needs if we got a grip of the PFI contract.
Okay.
And it's not just in healthcare, it's in schools as well.
Let's put that to John McTiernan then. It's drawing money out that should be being spent on patients or school children. Good idea at the time, but now people are paying the price.
The problem in health, the problem in schools and education, is that for the last 13 years, the Tory government have forced austerity into health and education. Schools, hospitals don't have enough money for their running costs. That's the actual problem. It's nothing to do with the PFI. It's simply to do with the fact that public service has been starved of money. And the reason that Labour introduced the PFI in 1997 was we inherited a situation where primary schools in England still had outside toilets, and hospitals need to be rebuilt, and housing needs to be built, and housing needs to be renovated, and the whole of the public sphere had to be rebuilt. And rather than making people wait their turn in the queue, we did it all. We built actual hospitals, not the 40 fictional hospitals that are promised but not being delivered by this government.
We can see the appeal and the achievements, but you can't just dismiss the idea that a school is paying a third of its budget on these repayments, or a hospital by just saying the budget isn't big enough.
Well, of course you can, because the schools' budgets have been hammered down by the government. If the schools' budgets had kept in line with the increases that Labour were giving...
So none of it's the Labour government's fault?
None of it is Labour.
You could have foreseen how long these deals would last, and the interest rates might go up.
None of it is Labour's fault, because there's been a Tory government for 13 years cutting public service spending. PFI built hospitals, built schools, renovated the rail network, and it is the government's fault for not funding public services since 2010.
All right.
It's nothing for Labour to cop.
Stella Creasy, do you go along with that, or do you accept some responsibility for the previous Labour government in creating this situation?
John is right that public services have been cut to the bone by this government. But just as if a constituent came to me and said that they've been using a buy now, pay later loan to pay for their mortgage, so I'd want to look at the mis-selling that's gone on. So I think we have to recognise the way in which PFI is structured is hugely expensive, and we are committed to a further £200 billion worth of repayments. It makes good fiscal sense to look at whether those contracts are fair. I'll give you a good example of this. Many of these contracts were signed when these companies signed up to pay a much higher level of corporation tax, and that was part of the value for money assessment.
Right.
Now, over the years, corporation tax has been cut. So clearly they are getting a better deal, and it's right that we look at whether we as the public sector could get a better deal and put some of that money back into our schools and hospitals.
Let's look forward, John, rather than arguing about how we got here, or clearly austerity has had a big impact. But Labour government may well be holding the purse strings fairly soon.
And we'll have to use...
Do you revisit, as Stella's saying?
There's absolutely no doubt in my mind. Labour will come in with the worst crisis in the public square, in the public sphere, in terms of capital, because we've got the water industry pumping sewage, raw sewage into rivers. You've got schools which have crumbling concrete. You've got
the cost of mending PFI.
Well, we're going to have to deal with every single element of what we come in. Because the government have been strangling public services, we'll have to find a way to put more revenue in. And the Labour identified tax increases to switch into particular bits of service. In terms of the capital required to do everything we want over the first term, and I hope the second term of a Labour government, if we get elected, we'll need to go back to the private sector. We cannot borrow as a government the amounts of capital we need to renovate the country. So we'll have to
PFI
find
2.0.
Well, we'll have to have some kind of public-private partnership, because if we don't, we'll have to be saying, if health gets this, schools can't get that. That's not acceptable. We'll have to find an acceptable way of lowering the cost of capital for the private sector, and then finding a way to borrow with them, to work with them, to invest with them, sometimes de-risking for investments in energy, but sometimes actually having a public-private partnership. At 2.0, there's a lot to learn, but the problem we have is high inflation. High inflation, it increases all costs, and if you don't get enough cash...
I haven't got much time, and I do want to go back to Stella on this, but just briefly on HS2, PFI, to finish that up to Manchester, would a Labour government take any different view, or is it, frankly, someone else's problem that they'd rather not be dealing with?
I think the cancellation of HS2 is a betrayal of the North, is a betrayal of the commitment to raising and to reducing regional inequality, and a Labour government has to be able to do the kind of transformative infrastructure investment we need in all the spheres.
And Stella Creasy, last word, does the sound of resorting to PFI in a different form perhaps fill you with hope or dread, and what would you do about HS2?
Look, we had to learn the lessons about having used the private sector in such an expensive, exorbitant way, just as we did with payday lenders and buy now, pay later lenders. So the public sector needs to get better. Things like sovereign wealth funds, I think, are part of the solution, separating out the service management contracts from any kind of investment, and recognising that letting profit being made within the NHS is money that can be going into public services. So we need to get better at managing projects ourselves.
Stella Creasy, John McTurnan, thank you.